Hepatitis. Causes, signs and symptoms, diagnosis and treatment. 1. Overview. Hepatitis refers to inflammation of the liver commonly caused by viral infections hepatitis A, B, C, D, and E. However, it can also result from autoimmune diseases, alcohol abuse, toxins, medications, and metabolic disorders. 2. Causes of hepatitis A. Viral hepatitis. Hepatitis A have transmission, fecal-oral route, contaminated food, water. Course, acute, self-limiting, no chronic form. Hepatitis B. HBV transmission, blood, sexual contact, perinatal transmission. Course, can be acute or chronic, risk of cirrhosis, liver cancer. Hepatitis C. HCV transmission, blood for drug use, unsafe medical procedures. Course, often chronic, leading cause of liver cirrhosis and cancer. Hepatitis D. HDV transmission only infects those already infected with HBV co-infection or superinfection. Course, can worsen HBV infection. Hepatitis E have transmission, fecal-oral, common in developing countries. Course, usually acute. Dangerous in pregnant women. B. Non-viral causes. Alcoholic hepatitis, due to excessive alcohol consumption. Autoimmune hepatitis, immune system attacks liver cells. Toxic hepatitis, from drugs, for example, acetaminophen overdose, toxins, or supplements. Metabolic disorders, Wilson's disease, hemochromatosis. 3. Signs and symptoms. Acute hepatitis symptoms: fatigue, jaundice, yellowing of skin, wise, dark urine, pale stools, abdominal pain, especially right upper quadrant, nausea, vomiting, loss of appetite, fever, joint pain more common in HAV, and HBV. Chronic hepatitis, HBV, HCV, HDV symptoms often asymptomatic for years, progressive liver damage leading to cirrhosis, ascites, variceal bleeding, hepatic encephalopathy, hepatocellular carcinoma, liver cancer, fulminant hepatitis rare, life-threatening, sudden liver failure, confusion, hepatic encephalopathy, severe bleeding, coagulopathy. 4. Diagnosis. Blood tests, liver function tests, LFTs, elevated ALT, AST indicating liver damage, high bilirubin, jaundice, low albumin, chronic liver disease, viral serology. HAV, anti-HAV, IgM, acute, IgG, past infection, vaccination, HBV, HBsAg infection, anti-HBC exposure, anti-HBs immunity, HBV DNA, HCV, anti-HCV antibody, HCV RNA confirms active infection, HDV, anti-HDV antibody only if HBV positive, HEV, anti-HAV, IgM, other tests, PT, INR prolonged in liver failure, autoantibodies, for example, ANA, anti-LKM for autoimmune hepatitis B, imaging, ultrasound. Assess liver structure, detect cirrhosis, tumors. Fibroscan elastography measures liver stiffness, fibrosis. CT, MRI, detailed imaging for complications. C. Liver biopsy, gold standard for assessing fibrosis, cirrhosis, and inflammation. 5. Treatment. Viral hepatitis treatment, hepatitis A and E. Supportive care, hydration, rest, no specific antiviral treatment. Hepatitis B, acute, usually self-limiting, supportive care. Chronic, antivirals, tenofovir, entecavir suppress HBV replication. Monitoring, regular LFTs, HBV DNA levels. Hepatitis C, direct-acting antivirals DOS, Sofos, Bouvard, Velpatasvir, Glecaprevir, Pibrentasvir, cure 95%. No vaccine available. Hepatitis D, pegylated interferon alpha, limited efficacy. Managing HBV co-infection is crucial. B. Non-viral hepatitis treatment, alcoholic hepatitis, abstinence, corticosteroids, severe cases, nutrition support. Autoimmune hepatitis, immunosuppressants, prednisone, azathioprine. Toxic hepatitis, discontinue causative agent, unacetylcysteine for acetaminophen toxicity. C. Liver transplant required for end-stage liver disease or acute liver failure. 6. Prevention vaccination, available for HIV and HBV. Safe practices, avoid sharing needles. Safe sex HBV, HCV, proper hygiene have, HEV. Screening, high-risk groups HCV, HBV. Conclusion: hepatitis varies in cause, severity, and treatment. Early diagnosis and proper management can prevent complications like cirrhosis and liver cancer. Vaccination and lifestyle modifications play a key role in prevention.